So from the work of Dr. Pete Dawson, we know that there are some criteria to a stable occlusion. Number one, we want the joints to be in centric relation. We want anterior guidance within the envelope of function. And we also want posterior teeth that do not rub. Now, my friend and mentor, Dr. Leonard Hess, really helped me understand this when he drew some sketches of an egg on an articulator. And since we're so ecstatic about occlusion, what I thought we could do is kind of demonstrate this live. What we have here is an egg mounted on an articulator, and in case we break anything, we got a couple extra. What we have here is the egg mounted in CR. The egg represents the posterior teeth, and the pin represents the anterior stop. The inverted tripod concept remains true as the condyles are fully seated. The articulator is unlocked, and I will represent the force of the contracting elevator muscles by pushing down on the articulator. No matter how hard I push, the egg will remain intact. In this demonstration, we're going to represent the egg mounted out of CR. While we change out the plates here, I'm going to close the articulator. And I want the anterior pin seated to represent the joints out of CR. Now when I apply the force that represents the elevator muscles contracting, let's see what happens to our friend the egg. Scrambled. In this example, the egg is mounted in CR, but of course there are no anterior teeth, so there's no anterior guidance. The egg represents the posterior teeth. So we're going to unlock the articulator. Nothing's happening when I'm applying the force, but what happens when we go into a lateral excursion? So here now, we've switched out the plates to some that have anterior teeth. Notice I have the pin raised because we have the teeth to represent the anterior stops. What happens if we go into a lateral excursion? Well, with canine rise, the egg stays intact. So the other way that posterior teeth rub is if we have poor or bulky contours on a posterior tooth. Let's say we do a crown, and we replace a tooth with the restoration that's larger and bulkier. Of course, the egg's going to break.